Why don't we just start 7:04? Call to
Okay.
order 7:04. And why don't we go around and introduce ourselves, board? I'll start with myself, Caroline Kinsella, the health director. Emily?
Hi, I'm Emily. I'm the assistant health director.
Jean? Oh, Jean's there. She hasn't answered yet. Jean Peterson is our clerk. Roxanne?
Hi, Roxanne Musto, Chair.
Laura?
Laura Richard, secretary.
Okay. Okay, so, oh, Jean just come off mute. Jean, can you hear us? Okay.
Yes.
Okay, perfect. Thank you. Okay, we'll move along to number 2, approval of the meeting minutes from July 21st. If you could take a look at the minutes, board.
I looked through them earlier and I had no changes.
I had already looked at them as well. I'll make a motion that we approve the minutes from July 21st. Second. All right,
Aye.
all in favor? Aye. Okay.
Aye.
Thank you.
Thank you. I just want to make note also that Mary Stenson wasn't able to join tonight. Number 3 is citizen speak. Would anyone on the call like to speak?
I
You
would.
can raise your hands, or Mr. Chambers?
Yes. Good evening. I'm Roy Chambers. We had a meeting back in June with the health department where the DPW presented a request for a permit to trap beavers in the Pine Tree Brook. And I was just wondering what the results of that was. Was the permit issued? And was there any follow-up that you know of?
Would you like me to speak, Roxanne?
I think
Do you
sure. If you
want me
want to, yeah, I mean, if you want to give an update on that part of it, that's fine. Sure.
So, yes, the Board of Health did approve a permit for beaver trapping at that time due to safety and health reasons. And I did get an update from Marina Fernandez, who's the DPW director. She said that they caught 9 beavers in total, 4 over at the golf course side, 5 in Harland and Unkedy. She said they set up cameras last week, and so far they haven't seen any other activity. What they're going to think about next is taking down the dams, and they're going to be talking about proposals and plans for that in the next couple of weeks. So it looks like they trapped 9 beavers.
Okay. Good. I tried to get some information on it and I wasn't able to, so that's why I came tonight. But thank you.
Thank you. Is there anyone else that would like to speak at Citizen Speak? Seeing no one else, we'll move along to number 4, which is 5-9 Thatcher Street, discussion of violations, correction order and potential vote to condemn this property, 105 CMR 410, minimum standards of fitness for human habitation, 410-650 F, condemnation order to vacate, order to secure. And after speaking to town council today, we are going to defer this to our next meeting. They're going to be working on 5-9 Thatcher Street. So that's going to be deferred this meeting. We're not going to be talking about it. We're going to talk about it next meeting. Okay. All right, then I'm going to move along.
Caroline, excuse me.
Sure.
I'm just wondering, I see that Mr. Toddy's here. I'm wondering if we could move up his his item
That's
next,
great.
and then we
Yes.
can go back to everything else so he doesn't have to wait.
Perfect.
Thank
That
you.
sounds great. Okay, we're going to
Thank you.
skip from number 4 to number 7. The body art practitioner, Mr. John Toddy, Scalp Designs, is requesting a variance regarding mop sink discussion and potential approval of a variance. And I don't know if you remember, board, I'm not sure if you remember, Laura, the last body art establishment that we did have, we did grant a variance on the mop sink, and they did have a Swiffer. So if you want to talk a little bit about that, Mr. Toddy, to let us know what you have plans for and what kind of sink you have there.
Yes, thank you. Thank you very much. My approach to safety is very important. Sanitation My treatment room, I take very seriously. I treat my studio the way I would expect others to treat me if I was a client. It's interesting you say that with the Swiffer because that is what I use. I just find it more sanitary because it's a one-time throwaway. It's my everything I do is a one-time use throwaway item, which I find more sanitary than a mop, which can be reused. And my treatment room's 6 by 9. It's small, and it's just I feel like it keeps it cleaner than using a used mop. I've always used the Swiffer, always. And yeah, it was an oversight when I was going through everything. When I saw the janitorial sink, I'm like, well, I just use the Swiffer. That's fine, But I should have said it, and let Carolyn know or who I was talking to that's what I've been using, and it's worked. It's worked well, great, really great. I do have a sink for hand washing, hot water, cold water. Soap, has attached paper towel dispenser. I have a Sharpie box on my wall, a glove box on my wall. Everything's set up the way it was before. I've always been compliant. Safety's number one, and sanitation. And honestly, the reason I came to Milton was because Milton's such a nice town. Seriously, it is. It's unbelievable. I've been walking around. As Stoughton, I didn't get to walk around at lunchtime, and I've been able to walk around, and it's been awesome. Just the downtown's really nice, and it's a really cool place. And yeah, I'm just really eager to have my clientele here, and I feel really, I feel grateful that you guys gave me the chance, first of all, to open up, and yeah, that one last thing there was the mop sink, which I did not do because I had always used a Swiffer, and I was wondering if I could have a variance to that mop sink and continue using the Swiffer.
Do you have any questions, board? Would you like to go ahead and grant a variance?
I'll make a motion to grant the variance
I'll
That he's
second.
that he's able to use the Swiffer.
Yeah, and I'll second.
Great. And all in favor?
Aye.
That's great.
Awesome.
Thank you. Thanks for coming in.
Thank you very much. You guys have been
Thank you.
awesome.
Thank you.
Thank you.
Take care.
Take care.
Thanks.
Okay, look. All right, so I'm going to go back to number 5. The opioid abatement grant opportunities discussion and potential vote to approve. I'm hoping that you got to take a look at the grant request that Emily and I put together regarding the grant opportunity for $20,000 for the opioid abatement funds. I don't know if you had anything that you want to add to it. I did speak to town council, to Peter Mello, and he said that if you do agree to vote for this tonight, that it's subject to any final edits acceptable to town council. So I sent it to town council to take a look at too. So this would be, right now, it's going to be considered grants for once a year. It might be twice a year next year. We'll have to see how it goes. And the organization fills out their funding needs. They say what kind of category is it: prevention, recovery, supports, education. They have a description of the program that they wanted to do in Milton that's going to serve Milton residents, the goals of the project, the outcomes and evaluation, sustainability, diversity, equity, inclusion, and belonging. We also included the budget. So it's going to be they're gonna have to submit a budget sheet and a budget narrative of how they're gonna spend the money. And then also we have reporting requirements. So a mid-year report is due in 6 months, and then an end of year report is due no later than 12 months. Just a deliverable to let us know how many people that they reached in Milton. Was it successful? And do they engage underserved members of the community or those with lived or living experiences related to substance use disorder? And then the applications must be submitted by October 31st. And they're submitted to the health department. Emily and I will look over them, and potentially Ann also can look over them. And if they are deemed to go forward and have all the information, we bring them to the board for the board to vote on them.
I have a quick question. How will people be aware
That's what I
of
was
the
just.
opportunity? You know what I mean?
We're going to have to advertise.
So
Is-
how and where would you do that?
So we could put it on our website. We could do it, put it in the paper, Facebook. Where else can we put it? We can put it in the Milton Scene.
I
Any
have a
other ideas?
question. If
Yeah.
we have to get it out there, is October 31st enough time for someone to prepare all of this? Should you make it later?
We could make it November 15th or the end
Yeah,
of
I just,
November.
seems like
think-
that would be kind of a rush to,
Mhm.
I agree with Laura. I think it's a short timetable because you're,
That's
almost, if you
fine.
think about it, almost mid-September, I
Right.
mean, thereabouts. And so that's not really a long time because you still have to advertise it. And
Right.
so I do agree, a little longer timetable would probably be better.
Mhm.
Cool. What month? are you
Maybe the
thinking?
end of November, do you think?
Yeah,
Like
you could do
November
that. And then-
30th?
Yeah, and then
November
see what you
30th?
get in. I mean, you may have to re-advertise it too, depending what you get.
Or we can change that to November 30th.
Mhm.
Is there anything else that you see? That I might include?
Thought it was really well done.
Yes. Looks great.
You want to make a motion that we approve this opioid abatement funds grant request form? Or we can put that out there?
So I'll make a motion that we can approve the opioid abatement fund request form. However, we also need to put in there something about town council,
Oh,
right?
yeah,
Because they
and
have to
then-
review
yes.
it. So that
And so
language he wants,
Subject to the
That's so
review
subject
of
to any
town.
final edits acceptable to town council.
that's how we would do it. All right, I'll make a motion that we approve it with that caveat. Second,
I'll second.
all in favor?
Aye.
Excellent, thank you. Okay. Then we're on to number 6, the Parent and Newborn Support Services Program and potential partnership with Wellesley Health Department discussion and potential memorandum of understanding between health departments. I just wanted to open up the discussion a little bit about this. In our community health assessment and our plan going forward, we did discuss some more programming for the town that was in our CHIP. And then one of the foundational public health services that we should be providing, and that's coming out, is the maternal and child health. So they do have it's not called Parent and Newborn Support Services, but it's like a North Shore collaborative that they do have. There's probably about 12 towns in that on the North Shore. And they do some home visits for new parents and newborn services. Wellesley has more. They have more staffing and they have more resources than Milton. So I had talked about this before. This is within our Norfolk County 8 collaborative. So I had expressed interest in starting this support program for parents and newborns, and Wellesley also. So we're kind of like the two that are first starting it out. So in Wellesley, they have a full-time nurse, another part-time nurse, and they have nurse Amanda Stone, who's working on specifically the Parent and Newborn Support Services program and getting it started in Wellesley. And then there's another nurse that's hired per diem that's more of a pediatric nurse, on maternal and child health, so they can also assist us. So it's just starting us in the beginning phases. We're talking about potentially a memorandum of understanding. We haven't had that meeting yet with Wellesley, but Amanda Stone did reach out, and Amanda Stone is a public health nurse that I used to work with. She used to work in Mattapoisett, and she's kind of spearheading this with the Wellesley Health Department Director, Lenny. So they're working on all the paperwork and stuff for this program. But I think it's a really good opportunity for Milton to do this parent and newborn support services. It's going to be rolled out very slowly. And so we'll have to, figure it out as we're going along here. But I think that it'd be a wonderful opportunity for us to start this program in Milton. So it's just in the beginning phases, and looking to Wellesley because, as I said, they have more resources. And we're supposed to get another nurse that's supposed to be coming in to help the 8 towns, and another epidemiologist. So we did have a nurse and we did have an epidemiologist, but they just left. So one was fired and the other one left. The epidemiologist was fired out of Norwood. So so we're hoping I'm going to be on the interviewing committee for this new regional nurse. And one of the things is they have to have some experience with maternal and child health. And so they can help us too, if they are available to. And they should be, because I don't expect really a lot of calls to come in, but it's all a process. So I'm looking forward to starting something.
Is this tied in with Newton Wellesley then?
They'll be tied in with Newton Wellesley. Yes.
And do we have any idea of what they're thinking? Going to roll it out yet, or what types of services they're looking to do with this program?
So we haven't really figured all that out yet. This could be as little as providing paperwork, or providing referral services. And maybe we just Milton doesn't have the capacity to get out there right away. But if we can make the contact with someone in Milton who needs contact, or to be able to give them a referral, or go to their house once, maybe twice, to help them identify what they might need. I envision it something like that. Like an extra layer.
Concept,
We don't have BID Milton Hospital doesn't have maternity, but
Boston does.
Catch up with Boston
does,
and the obstetricians, and say, yes, we're just one more point of contact to help get people access to service or access to care. So that's what we're hoping to do.
Sounds good.
Yeah, it does sound good.
More talks about it, and we're just going to go slow and steady all this out. So I just wanted to make you aware, and I'll let you know how it goes with meeting with the Wellesley Health Department and what they're thinking too. Okie doke. All right. Then we'll move down to number 8, follow-up discussion regarding healthcare capacity audit of South Shore and Norfolk County, and sending a follow-up letter, discussion and potential vote. So, Laura, go ahead.
I was going to say, so basically, we had sent that letter in January to the state. We heard back in April, and they didn't really offer much in terms of solutions, except for, that we could reach out to them to discuss, concerns or, forward. And Caroline did reach out via email to them, and to Sam Wong, I believe. And I don't know, can you just explain what his exact role is? He's the regional, isn't he? For the DPH. But she reached out to him, and he forwarded that email to somebody else that he said could get in touch with us, and we have heard nothing.
Mhm.
And so that's where it ended up. And meanwhile, the situation is really getting pretty bad from contacts I have that are inpatient. From what I'm hearing from people that are patients of mine and their families, and it's, it's really getting really crazy. I mean, I had a patient, I'll just give an example. I had a patient the other day. I sent her in. She was very sick. She ended up in the ICU. They looked around. They didn't think that having one open, so they kept her, put her down to the floor a couple of days later, kept her there one day, sent her back. She came back to our facility. I ended up sending her right back. She was very sick still. So I think there's a lot of internal things like this going on. And, I just think that we need some more answers. And, that's the thing is that it was more to follow up with them and see what they're going to do about this.
You're right, Roxanne. And it was Sam Wong. He's the director, Office of Local and Regional Health at Mass Department of Public Health. And he did copy Dr. Kate Philo from the Department of Public Health to answer our questions, but she didn't get back to me. So.
And when was that date? Because I thought it was May.
Right, May 28th.
May 20th, that was right.
28th.
Okay.
Yep. So there was no response. And you're right, with all the closings of Kearney Hospital, Lindsay Hospital, Norwood Hospital, and that's really impacted BID Milton Hospital. And you'll hear more stories like that. My brother recently went up with his daughter up to BID Milton, and he was there for hours, and then he finally left in the emergency room. But he said it was so crowded and there was people out in the hallways. And just too bad. We just have so many people that need beds or need to be seen in the emergency room and just not enough.
And I think that the thing is that the inpatient side is where we've lost these beds. And I know Milton's going to build on some emergency room beds, which is great. And they say a few of them are going to be observation beds, which means that they're not really emergency room. They're not really on the floor, but they can be there for a longer period of time, like 2 days or so, which is great. But they're only building 18. And when we've lost 570 plus in the whole catchment area, there's a lot of pressure. I mean, you just drive around town, look at all the traffic and look at all of when I say that, in terms of almost every day you see another ambulance, and I always look to see where they're coming from. Canton, Randolph, Boston. So it is a little crazy, So the thought was to follow up on that because we never really did. We sort of just let it go, but we really should follow up on it because we represent everybody in the town and the health of our population in the town.
Right.
So that was the thought on that. And then, we could figure out who exactly we need to send it out to. I think probably the same group. There might be some fluctuations. I think, I believe Kate Walsh is not there anymore. They replaced her with somebody else. So we'd have to look at specifically who to send it. And I would just suggest that on the bottom of the letter, we write down who we've sent it to. And, instead of individually, that would be my suggestion on the letter. Yeah. And, anything else you can think of.
I thought the letter was excellent.
Oh,
that
great.
you sent.
Great. So yeah, we could just, tidy it up, Caroline, I think, in terms of who it's going to go to and all of that, and then, send it out. And, what do you think, Laura? Does that seem okay with you? And
yeah, no, I thought it.
Okay, that sounds great. I'll put letterhead on it. I will construct a list of who we can send it to.
I have one little housekeeping thing on it. It
Sure.
says, as the chair of the Milton Health Board, along with my fellow board members, which is fine, but then you sign it Milton Board of Health. So you have to kind of either sign it as the director.
However you all want to do that.
Yeah.
You make it that you can make a decision on that one. Because it's really from all of us. So however you want to do it. If I'm going to sign on behalf of the board or whatever,
it just doesn't
flow right. It doesn't match. Yes. You're absolutely right.
So as the chair of the Milton Board of Health, along with my fellow board members, just like the bottom, wasn't that matching the bottom? Is that what you're saying, Laura?
Yeah, then it's signed as the whole board.
Yeah, okay. I agree.
I will put that together. I'll work with Emily.
We'll just look at it. Yeah.
All right, that sounds good. Perfect. Okay, so moving on. Let's see to the health director's report. A couple things I wanted to talk about. The Norfolk County Sheriff's Office is coming into the health department. They're going to be bringing that MOU. And for that $2,500 for the sober living, if a Milton resident is in need, and I know the board did approve that. I think maybe the last board meeting, so they're coming in, I believe, this week with the MOU. What else? 68 Smith Road. I did call the supervisor of the asbestos, is Adriana Banks, and she said that they did that asbestos work, or they were in the process of doing it. I think it should be done by now, so I'm awaiting an update about that final report on the asbestos. I know it's in the queue for inspectional services, so a lot of stuff has come in there, but I'm not exactly sure how far they are with that.
Mhm.
And then we're gonna 5 to 9 Thatcher, we're just going to defer that. And then just something I wanted to put on your radar is there's a new preschool coming into Milton. It's called the Gardner School. And it's coming as just 675 Blue Hill Ave. And we're reviewing plans for their kitchen now. So just want to let you know about that. We also had International Overdose Awareness Day, an event we had at the town hall, where we planted some purple flags and lit some purple tea lights. And you were there, Roxanne. Thank you for coming.
Mhm.
And we did have a number of people come. I think every year it'll get bigger with more advertisements. And it seemed like the people that, this is what they wanted. This was people in our coalition, our Milton coalition, with lived experiences. And they had input into how they wanted this International Overdose Awareness Day event to be conducted. And we did what they said. They wanted to do it this way and plant the flags and honor their loved ones who passed away. And our next step is that we're going to be honoring their memory by working with the library. And on October 20th from 6:30 to 8, we're going to have an event where people can share their photos of their loved ones and they can upload them. And then we're going to put them in the library. We're going to put them in the near the keys room, where they said that there's a lot of people that come in and out of there. But we're going to work on that. I'm not sure exactly what that's going to look like, but our two new project coordinator and the project director for the Milton Coalition, they are going to be working on it. So interested to see what they come up with. So that's our next step. We're going to be putting them in paper too, so people can upload photos of their loved ones and we can honor them. This is a continuation of the International Overdose Awareness Day. So that's coming up October 20th. And then we have seasonal flu clinics coming up in October, working with the Council on Aging, and we're going to be doing 2 clinics like we did last year, October 22nd and 23rd, 4 to 6 at the COA. And then we're also going to be going to Pierce, and we're going to be giving them to the kids, and that's October 29th, 4 to 6 at Pierce. So.
And Caroline, as far as what you're getting for flu vaccine, are you getting the high dose, or are you just going to get the regular, right?
So we do have high dose, yeah, and now they're all going to be. We'd originally ordered multi-dose, but now there's a thimerosal that's being taken out of the vaccine, so it's all single dose. So now we're getting all single dose. So we're getting from the state, we're receiving 250 doses for the children, and we order 250 every year. And then for our regular doses, we ordered 270, and our high dose, we ordered 150 doses for this coming year.
And how did you do last year in terms of, did you have a lot left over?
There was
that's what I'm wondering, what the amounts that you're getting.
So we decreased the amount. I think we decreased either 50 or 70 doses from last year. It's kind of when you're making these clinics and trying to figure out how much to order. But I think that last year, I don't know what it was, but I talked to many health departments that people just did not go out and get the flu vaccine, at least at the health departments. And I'll tell you, I was really aggravated last year because the system that we have is called the Color Platform, and they instituted this. It's a state platform. I'm not positive it's a state platform, but I think that it is. Anyway, it's called Color. I'm pretty sure it's a state because they wanted all this data. I think I complained about this before to you,
Oh,
Roxanne,
yes.
about
Yeah, I remember
how
this.
I had to ask 15 questions before I gave a flu shot, and CBS doesn't have to do that.
No.
So I got on one of their Zooms and I said, I'm really upset about this. And not only am I upset about I have to ask 15 questions, but we had many people come in and say, this is too much. Why am I being asked all these questions that weren't relevant? Like one of them was like, are you afraid to get the flu vaccine today? Something, and other things I had said to you before, like another question was, do you have HIV? Well, why do I have to know that? And why am I asking that in a public clinic? No relevance to anything. I would give it to you anyway.
But you
So
would think there'd be like HIPAA violation with something like that
Oh,
anyway. You know what I
that's
mean?
ex-
You're in a public place and you're asking these questions. I
it
think that's
doesn't make
really
any sense.
doesn't.
And
Yeah.
I told them how I exactly expressed that to them. And I said, this is not acceptable, totally not acceptable.
Are they doing it again this year like that?
So I
That's what I want to
complained-
know.
I complained again this year and they said they decreased the questions. So I haven't opened up the package yet. They did say they decreased the questions. So I'm hoping that some of these questions, which were irrelevant, are off of there. It's just, and people were really aggravated about that, including us.
Well, it might turn people away, you know what I mean? Because if you
It-
can go down to CVS and they ask you one or two things and you can get your shot, like why would you run into the Board of Health, no offense, and like have 20
Absolutely.
questions?
Absolutely. They were just gathering data
Yeah.
and it really turned people off. They were like, why do I have to answer these questions? And I get it. So when I got on a call, I got on a call with them, I think 2 weeks ago, and they said, oh, we decreased the questions, but I haven't gone into the package yet. I'll have to see how much they decreased it. Yeah. So
By one.
I know, just unbelievable. So we did decrease the amount that we did order.
Mhm.
And as I said, last year was it just wasn't good. And then we have Drug Take Back Day coming up the last weekend of October 25th at the Milton Police Station. I put in for capital requests. I put in for a new vehicle again. So we've been asking for a new vehicle for the past couple of years. We have a Toyota Camry and it's 16 years old and it's broken down a number of times. And I don't know if you don't remember the story that, it's going backwards instead of forward. And we had to all get out of the car and be like,
Oh my
you got to
gosh.
tow it from there because it was really doing that. So I did talk to DPW and they recommended a new vehicle be a Chevy Equinox EV. So I guess that there's so much of the electric cars that they have to purchase, and maybe now it's all electric cars, but they recommended this Chevy Equinox to replace our Toyota. Our Toyota doesn't have any backup cameras or any, it really is outdated. Not only, I just think that, I'm hoping that they give it to us this year. It's $50,000, about $50,000, but they have to start replacing some of these vehicles that are just not safe anymore. So I put in for that anyway. I already gave you an update on the beavers. And then I wanted to let you know about the two camps that we are actually going to the camp, to the Curry College and Milton Academy. The Camp Beeston at Curry and the Camp Real Madrid in Milton Academy. They weren't given permits because they just gave us the paperwork too late. I mean, one of them gave us the paperwork the night before, and Sue, they're aware that Sue only works 2 days. I had to go out there on a Monday, see what they had, and it just it's not fair to anybody that we're getting their paperwork the last minute. And
Hmm.
it's not fair to Sue, it's not fair to me, it's not fair to the kids. You know what I mean? We could have closed them down. So what we're gonna do is we're gonna go in person and talk to them at Curry and at Milton Academy in the next, I think, 2 or 3 weeks, and say to them that they have to give us all the paperwork 2 weeks prior to running the camp, 2 weeks prior, not the day before the camp, because it has to be looked over. We have to, because there's always a problem. Someone needs a vaccine, someone needs something that they didn't do. And it has to be 2 weeks before. And if they can't honor that, then they're not going to open up. They're not going to get a permit. And we're going to say it to them 2 weeks before. So, the kids won't be at the camp yet, and the camp is not going to be opening. So I think that we have to take a hard stance next year. And I'm going to tell them that right now in the fall. This is what we expect from Curry and Milton Academy. And if the camps can't honor it, then they cannot open up. So.
I think the other thing is to also make it a point to meet with them again in the spring and
Okay.
say March, like March, I would think,
Mhm.
because then they'll have an idea, maybe, I would think, at
Yeah.
that point of who's coming in for the summer. I mean, they may have some straggler camps too, but at least you have a sit down with them again and remind them. Sometimes the people that are in charge of this stuff at the schools change too between now and then. So I think it would be a good idea just to go back in the spring, say March, and you and Sue go over there and meet with them again and say, hey, what camps do you anticipate coming in here?
Right.
And then you have a letter ready, perhaps from the Board of Health, that tells them what is needed. And you say, send this out to the camps that you have coming in. And it says on there specifically that we need everything at a minimum 2 weeks before.
Right.
And, and that we will shut it down if we don't get that. You know what I mean? So you say it now, but you also say it again in the spring.
Yep, we can go back in the spring. Sue's really good, and she gives them all the information,
I
and she
know.
holds their hand, and she works with them very closely, and they just didn't pull through. No. So yeah, we'll go in this month to talk to them, and we'll go in
Okay.
the spring too. They should be getting it. They should be at least submitting that they have a camp coming 3 months before. That's
Okay.
that's in the regulations too. So.
Mhm.
Is there anything else that you're thinking of? I did want to say that I was approved for the next step, so I'm going forward with my reclassification, meaning at least it's moving forward. I haven't been approved yet for the reclass, but I think a
Good.
consultant is going to speak to me. There's only 3 reclasses from the union that go forward, so I'm
Mhm.
hopeful that I'll get a reclass from level 9 to level 10. We'll see what happens there. Anything else, Emily, that I'm missing, or Roxanne or Laura? You can think
I
of?
don't think so.
Covered a lot of different topics.
As we always do.
Always do. All right.
So looking at a couple of weeks. Do you have
Yep, we'll
anything
send that-
coming in that you anticipate?
Is there any septic coming in, Emily?
Not that I know of.
Okay.
So number 10, looking for a future meeting date.
Mhm. What's good for you guys?
September.
I'm looking in October, but what dates are you looking at?
So the 13th is Columbus Day. You don't want to do that day.
Or the 20th, if that works for people. Does
works
that work for
better.
you?
Works for me.
Yeah, because I think the following week is town meeting, the 27th, right?
I can't remember.
Yeah,
That
it's the
sounds
20,
about
I have it
right.
written down the 27th. So,
Yeah.
is the 20th good for you guys?
The 20th
Good
is
for
good.
me.
Yeah,
It is.
that's good. October
Okay,
20th.
so let's do it on the 20th then.
So it's going to be 7 p.m. on Zoom.
Sure.
Okay. Okay. With that,
Alright.
we can, what time is it now? It's 7:44. Adjourn the meeting at 7:44.
Sounds
Alright.
good to me.
All right. Good night,
Can I make a
everyone.
motion
Thanks,
to
good
adjourn?
night. I'll
Yeah.
make a motion to adjourn.
Perfect.
Okay, all in
second.
favor? Aye. All right, have a good night, guys.
Good night.
Good night, everybody.